Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, ATH Alice. Welcome to our weekly show. My name is Abby. I'm your Healthy Living MP. How you guys doing? Hope all is well. Beautiful day in my neck of the woods there. So how you guys doing? As you can see, let me go back here and I'm gonna put my title up here. Sorry for this. Okay. Travel health and safety tips. Okay. Once again, please share the show. Please share the show. I'm gonna get to my notes. How are you guys doing again? Welcome to all my new followers. Welcome. If you're joining me, welcome to people watching me from Focus in Liberia. Welcome to those of you watching me from YouTube. Please give me a thumbs up. Please give me a thumbs up. Please share the show. Please share the show. Okay, so I do this. I do travel and health safety tips every year. This year was a little delayed. I was doing like the Father's Day stuff and all. But anyways, we are here. Okay. So again, welcome. And also, let me just go in here. My disclaimer as always, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without first checking with your own provider. Okay. So let me go in here. As you can see, the title is Travel, Health, and Safety Tips. Okay, so right now everybody's going on vacation. That means like August. So most people have already gone on their vacations or plan on going later on. Not everybody goes early on in the year. Some people start going from May as soon as the weather gets nice. And some people go all the way into the summer or like early September around there, depending on, where you are and how the weather is in where you are. I'm speaking more for people who are in the weather in America right now. Okay. So even if you're anywhere else and you go in places and all, this also applies to you. Okay. Whenever your vacation falls and the weather in your area. So you go into vacation for vacation, like I said, you may be going abroad, you may be going maybe in the same state, you may be going out of state and all the neighboring countries and all. It's important to know certain things, so have certain things done before going on those trips, okay, health wise. Alrighty. So anyways, before going to your, especially if you have chronic illness, like if you have diabetes, some people have really bad diabetes that their blood sugar is like all over the place and it's really hard to get the numbers down. They have like uncontrolled high blood pressure and all, and other things. If you have like asthma and other like autoimmune diseases that you may have flare-ups, they say lupus and other things that may have issues. And so when you go away from your home, you're going to be away from your doctors, the doctors that know you, your primary care doctor, also your the specialists in the area that deal with you too, okay? Because if you have like kidney problems, you probably see a nephrologist, which is a kidney doctor. If you have lung issues, you see a pulmonologist, and people have like bleeding issues and all that with seeing hematologists. So you have to see these people maybe like every 3 months or so, or sometimes you have to see them if your symptoms get really bad. Okay, so if you go on vacation and you're thinking of going on vacation with your family and friends, or you're taking younger children or even elderly, you want to make sure that you have all this information together. So the first thing you want to do is talk to your primary care doctor, okay, and say, okay, I'm planning on going on vacation. I just want to, I was thinking about it, and I was online and I was watching Abby Tyler's Healthy Living because she is the, healthy living pro person. I hope you say that. Anyways, but so and I just wanted to know like what are some of the things that I need to be doing before I go on vacation? What are some of the things that I need to know about? Okay. If this happens, who do I call? Am I supposed to be calling you? Am I calling this other person? Also check with a specialist too, because again, like I said, they're going to be taking care of things along with your primary care doctor. And just check with them and say, okay, what are some of the things that I need to do? Do you think that if I'm going out of the country, or say I'm going to a country and you go into developing country, I don't like calling it third world or whatever. I like calling it developing country. Okay. And and the kind of illness that I have, do you think it would be a good idea for me to go there? And sometimes you'd be like, you haven't been to your places. Like for some of us who, came from other countries and all, do you think it's safe for me to go there? Like, if I go there, is something I may actually, because I usually talk to my patients too, and I was like, okay, so if you go there, do you have these things, these things, these things? And sometimes if I'm, talking to some of my family or friend too, do they have these things? Do they have all these amenities that you need when you go there? Okay, if something happens, excuse me for a second here. If something happens, are you do you have the care that you need right away? So, and sometimes people might say, oh, you're discouraging other people from going to their places, to their homes, and we'll just leave in. And again, like I said, science and medical science and religion and faith can coexist, okay? But being a provider, of course, you're by law, you have to say certain things to your relative, to your patients and all that, and document and all, because you can just say, oh, just leave it with God. And then, of course, you can leave it with God. I can tell you everything I need to tell you that you need to watch out for, and in the end, you will have to make that decision. Nobody can force you to make a decision either way. Okay, so your doctor or whoever cannot force you to make a decision either way. They would just will tell you the risks and benefits, and then you can make that decision. So, go in there. Do they have a hospital close by? Do they have this close by? Do they have a clinic? How's the roads? How's the do they have paramedics? If you call, if something happens and you have to go to the hospital right away, do you will you be able to get to the hospital in time? And all those things we're going to ask you. And then in the end, of course, then also when you want to talk about vaccinations, because before it used to be like the COVID vaccine that was mandatory before you go to other places, but we'll also talk about there are other vaccinations also that are required from that country that you're going to. So make sure you're asking your travel agents. And sometimes like you don't really need a travel agent anymore, but if you go into a travel agency, but you can also check with that country's embassy and all that, and see everything that you need. Make sure you get that, and things that you need that you may not, that maybe you're allergic to, let's say a vaccination or something else that they're requiring that you can't take. You want to discuss that with your primary care provider to make sure that they can write a note stating that, okay, because you don't want to get there and they say, no, you can't go because of this and you don't have anything else. So get all those things, accomplished way in advance before, when you're making this trip, make sure you do that. Okay. So, and anyways, if you're going to be pregnant, is it safe for me to fly if I'm pregnant? If you just had recent surgery, you haven't had any kind of therapy or anything like that, is it safe for me to fly? Is it safe for me to take long trips and all that? Because you're going to, most of the time, especially if you're flying overseas, you're probably going to be flying for at least 6 to 8 hours. Talk to your doctor and say, okay, they're going to tell you, okay, you're taking this medication and you want to be getting up and moving around so your blood doesn't settle in the bottom of your feet. And when that settles there and it clots up, it's like milk, it's supposed to be flowing. That's one of the things. If it gets like real cruddy up and everything, your blood just stays there because you're not moving around as much. And if that breaks apart, that goes into your heart, goes into your lung, or go into your brain, you can have like a serious devastating consequences from there. Stroke, heart attack, and everything. So it's important that if you just had recent surgery, if you're pregnant, all those different things, ask for, is it safe for me to travel at this time? Can I travel at another time? Or do I have to go for, if I'm going far away place, because I have to go to, let's say, a relative passed away, something like that. So talk it over to, and your doctor can give you advice that's specifically designed for you. Okay, not just, oh yeah, well, pregnant people can fly all the time. Well, what if you have high risk pregnancy? Okay, so, and when you're there, you want to make sure, I mean, carry, especially if you go in places where I said you don't have those things, make sure you carry like a safety kit, first aid kit. Make sure when you're there, watching your alcohol intake too, because when you're drinking too much alcohol and you get drunk, you're going to be making unsafe choices. So you don't want to, you want to come back with souvenirs. You don't want to come back with anything else that is not a souvenir. Okay, that will be maybe with you for 18 years, if you know what I mean, or maybe with you for much longer, like a disease that you can't get rid of. Okay, so stay hydrated while you're there. Make sure your vaccinations are up to date. Okay, and also with your medications, you want to you make sure you have enough medications to take you there. Let's say you're going for like maybe 3 weeks or 4 weeks. Ask your doctor, can you have enough medications that's going to last you at least, make it at least a month or so, or a month or two, because there's always emergency, that there's always a chance that you may stay there for much longer, or there's a chance that something may happen and you can't come back. So have enough medications at all time. Okay. And again, if you use like the last of the medication and you come back, you don't have enough time to make an appointment to see your doctor, and they can't call it in and all, because sometimes too, we can call in medications, but if you're overseas, we don't know how reliable the pharmacy is there for us to call, and sometimes the lines, the telephone lines and all that can cause a problem too. That's that pharmacy also is certain medications that we cannot call in, that we have to type it into the computer, and that has to go through directly to the pharmacy. Does your pharmacy have electronic system there where we can send the medications directly to? That's important also. All right. So make sure you have enough medications. If you're traveling with narcotics, you want to check with that embassy, say, okay, yeah, I have medications that I have to take for my pain, or I have to take for anxiety, or I have to take for whatever reasons. Can I travel with my narcotics? And how do I have to store it so that way they don't think I'm traveling with something that's, saying I'm taking this to go sell, or I'm doing this to do something else. Okay. So check with that too. All right. And, check that when you go into that place, so they have your reliable electricity too, because you may have to you may have to refrigerate some of your medications, so they have reliable electricity 24 hours. How can I get reliable electricity if I'm there, if you don't have it, where I'm going to be stopping? Okay, so all those things are very important too when you get there. Okay, let me go in here. I talk about the pharmacies and medications and all that too. Even if you're there, okay, sometimes you may have to go to the doctors while you're there. Primary care doctors, are they readily available? Because sometimes you can get on the phone with another primary care doctor over there and say, "Oh, my patient, this is your patient, and she's here, and can you tell me a little bit more about what's going on about that background and all?" So they have somebody there readily available. Also, when you go to the emergency room too. All right. So hospitals. So they have reliable hospitals there. Okay. You can, again, when you go to the emergency room and you're having issues and they have to, how far is the paramedics? Could you call the paramedics to get you to where you need to get to? So some places where you have to wait for the bus, you have to wait for the taxi. Even if you get in taxi, again, like I said before, if you have heart issues that and you're having a heart attack or anything, God forbid, and you have to get to the hospital within minutes. Okay, you had your arteries and they're closing in and it's closing in and closing in and all that, and what's that, blood vessels. All right, and you need to be able to, you need the paramedics to come in there right away, put you on put a mask on your face, start doing compression, and also put an IV needle, start giving you some emergency medicine. Do you have that? Okay, so let me just go in here. I think I was using my banner. So do you have that? Okay, so if you don't, if you have some serious chronic illness and all that, do you want to go there? Do you want to be there for a while? Again, like I said, nobody can dissuade you either way. The only thing your provider can tell you is to say these are the things that you need to watch out for, and then you can make up that decision yourself. I mean, LeBron James' son, he just had a cardiac arrest. I think last night or so, and he's like 19. When people sit there and talk about, oh, only old people can have heart problems and only old people can have, he's 19 years old, the best shape. I mean, more than most people that I know. Okay. And it's not, we don't know the reasons for it yet, but that can happen anytime. Your heart just electrical part of it just stops. Okay. So God forbid, if you somewhere where nobody knows how to use the CPR, you can do this basic CPR, but then you need somebody who come in there who has advanced on cardiac life support and all that. They have to be able to train. They have trained paramedics that have to do that with the monitor, the heart monitor, and everything else. The AED and all that, to be able to like defibrillate you so you can get to the hospital and get there as fast as possible. Do they have that there? Okay, so because that anything can happen, and of course people might say, well, anything can happen in America too. Anything can happen anywhere. Yes, yes. Nobody is disputing that, but I'm just saying, if you're going to be going away from your home, you want to be able to come back, have fun at your vacation, and be able to come back safely. Okay, you can't control everything else in this world. You can't control everything in this world. There are things that you can control. Okay, that's the reason why you have healthcare people, you have police people, you have this and that, because we tell you what you need to know, and then you make that decision yourself. Okay, what about urgent care? Sometimes you may not need to go to the emergency room. I did do a show on whether you need to go to the emergency room to your primary care doctor, or if you have to go to urgent care. Okay, so the primary, and I did. So if you didn't see that show, is something you can look back a couple of shows below there. So for those of you who are not on Abby Tyler's Healthy Living page yet, so check that out. Okay, so you may have to go to urgent care. Let's say because you don't need to be in the emergency room. You have something but I can't wait to see the primary care doctor, but you need to see in the urgent. Do they have urgent cares there? How far is the urgent care from where you are? When you go in there, you say, okay, I'm going to be stopping at this bed and breakfast, or I'm going to be stopping at this hospital, I'm at this house, or this place. How far is the nearest urgent care from where you're going to be stopping? How far is the nearest hospital from where you're going to be stopping? All those little clinics here and there. How far is all that from there? Okay. What do they provide there? Even, okay, let's say if you're traveling with children, make sure you have a brief history, have a written history of their medical history and their vaccinations. That's also good too for you, because you, when you get there, maybe your wife or your husband can just hand it on the folder over and say, this is what she's been going through. This is everything's right there. Because again, I mean, yeah, I don't know if the EMR system, the health record system, I don't know how well it is over wherever it is you go in, that it can speak to our EMR system, but it's just important. Have that written down. Don't have to put your whole, you know, back history and everything, but just the major diseases. And also, if you haven't had any surgeries, if your children already had any surgeries, so just write that down, when they had it, their allergies. Also, like I said, your past medical history and on medications that you take. Don't just put my high blood pressure pill. Make sure you put the medication itself that you take, how often you take it. Do you have any allergies to medication? Do you have any allergies to food? Do you have any? Because it's important. You have allergies to seafood and they have to do a CAT scan on you and they have to put a dye in you, all that. They also work with that, shellfish allergies and things like that. So all those things are important. Peanut allergies, that's important, for especially for those of us who go into all these different cookouts and all. Ask if the roast meat got some, peanut butter in there, okay? Because it's important. Some people can literally die just when having the taste of it on their tongue. Okay, it's not like you sitting there eating; you can literally die from it, even with little kids too. All right, so check when you're taking your kids to the hospital. How far is the nearest children's hospital? And also, you can say, okay, well, we don't have the children's hospital, but you have the adult hospital. Some adult hospitals can treat the children in the emergency room. But if the child has to stay over, so they won't be able to keep them in the hospital, because based on the laws and all, depending on the hospital itself, depending on the laws and everything, taking care of children, if that hospital does not have a pediatric unit, that child has to be taken over to the children's hospital. So how far is the nearest children's hospital? Does that hospital take care of children and all? Can you stay over with your child? Okay, can you call in all the time to say, yeah, especially if you're overseas or something like that, or somewhere in another place, you don't want to be away from your minor child while everybody else is somewhere else. So can you stay over there? What's the policies with children and all? Because again, like the hospital I used to work at, we didn't admit children. It took care of them in the emergency room, and luckily there was a children's hospital like right down the street. All right, so make sure you have all that. Do they have their EpiPens? Do they have the nebulizer? So all those things. If they take breathing treatment for the asthma and all, even for adults who have asthma and COPD, do you have your machines and all? Sleep apnea. If you have your BiPAP or CPAP and all, and you have to go to sleep again. Reliable electricity, because you're going to need those things to be able to sleep. You're going to need those things to be able to breathe safely, because you need your CPAP. I talked about sleep apnea before. You're going to need those things. So make sure where you're going, they have all of that there. Okay. If you have anxiety, like anybody, a child that's on the spectrum, or autism and all that, okay, make sure you talk to them and make sure you have their medication. Talk to their pediatrician. Make sure that okay, I'm taking them for a long drive, for a long plane ride. Okay, try as much as possible to start getting them used to that. It's your first trip shouldn't be like a long trip overseas, because they're not used to all that, and they may not be able to like stand the plane ride, and that can be a little, can be a little terrifying for them. So you want to make sure you keep them safe at the same time. Okay, yes, we want to go see your other relatives. We don't want to just never see them because of this and all. So you don't want to make them feel guilty because of that. But at the same time, you want to keep them safe. Okay, so talk to them, watch videos about how the best way to do that. Talk to the pediatrician also. And when you're there, make sure child trafficking. Okay, so don't just leave them anywhere. It happens over here, it happens everywhere. Keep an eye on your children. Okay. So if you just joined me, talked about that. And insurance, your health insurance. You check with your health insurance. See, do they have travels insurance? Okay, because there's some insurance company where they don't cover your health insurance if you go outside the state, if you go outside of the country. So you can talk to your travel agent and see if you need to get extra insurance. Okay, because then sometimes an insurance company would say, okay, we'll take care of when you're in the hospital, but we're not going to take care of you if you need to be in the hospital for much longer. We're not going to be able to take care of you if we have to fly you out of there. And remember, the most serious your problem is and all, they will have to stabilize you before they can fly you to the nearest place. So don't think you're going to sit in there and be going to the heart attack or something serious, and they're going to, the helicopter will come and get you and fly you all the way over to like a neighboring country. You have to be stable, because if they think there's something you're probably going to pass before they get to the next hospital, sadly, they probably won't take you, because then, you pay for money. Everything costs money. People say, oh yeah, money runs healthcare, money runs everything. You have to pay the people that's going to be providing the care for you. Okay, so it's important. and ask about that. All right. Ask again, ask all those questions. All right. It's important. Ask this question. I'm traveling out of country. I'm traveling out of state, or I'm traveling, it could be you going to Mexico, you could be going to Canada, you could be going over somewhere else overseas. Ask how much more. Sometimes it could be maybe you might have to pay like an extra $100 more, but it's worth it. It really is worth it. Okay. So if you're just joining us, this is Abby Tyler's Healthy Living page. I am talking about travel safety, health, and safety tips. Okay. So again, hi to people joining from Focus in Liberia, from YouTube, and the other places that I share too. Okay. And I'm going to share it again. So to those of you who are joining me now, thank you very much. Let me just see here if I need to address any comments in the meantime. Okay, Mike Hussey, thanks for safety and travel tips. As always, thanks for the advice and info. I enjoy the platform. Thanks again, Miss Abby. Enjoy the rest of the evening. You too. Thank you very much. And thanks for watching. Thanks for your continued support. Okay, so let me go in here. Alrighty, and elderly. If you're traveling with elderly, sometimes you taking your parents back home to see because they've been here so long, or maybe they just came for a visit and they're going back. It's important if you're taking them there for a visit, and so you want to make sure. Okay, so if they need the places they're going to be going, do they need a cane? Their cane to be there. Sometimes you need a cane that has the 4 prongs. It's called the quad cane that can rest comfortably on there. And sometimes when you go to the airport, you're going to be walking from one distance to the next. Call ahead. Say I'm going to need a wheelchair while I'm there. Fix my gloves. I'm going to need a wheelchair while I'm there. Okay. So have that arranged way ahead of time because you don't want to get there and everything's crazy. You know how the airport, everything kind of moves real fast and the security and all. So ask about that. Can they get up? And if they say they have to get up to show their socks or whatever it is, check on that. Some of them, they have pacemakers that may also put out the security, the monitor and stuff. Let them know that also. Do they need the walkers? If you're going out of season and the walkers, all those things can kind of, you have to pass it through security. Do they need it while they're in the plane? Because just because you take your walker and, but you can put it away if they have to go to the bathroom. You want to check on that also. Their glasses when they're there, anything that to keep them safe and from anything from serious fall. Because if you have an elderly relative, even with the fall here, where it's like, a little bit more advanced, that can be something serious and life-changing and lead up to death. So if there's somewhere else where they the fall, they hit their head, that can cause a serious problem too. So all of that, check with their doctor also. Okay, do they need extra medication? If they're on blood thinners, when do I stop this blood thinner? When they go in, they're going to be sitting there for a while. Do I need to do anything else? They may tell you, yes, get bandage or go ACE wrap. You may have to wrap their feet water, their whole leg water in the hospital, in the plane, because they're not moving around that much. They may need to take an extra medication or something. Just check with them first, so make sure. Okay, and while you're in the plane, like I said, get up more frequently and all, check with your insurance. If you have, especially for people who have sensitive skin, I have sensitive skin. All right. Before I always tell people I'm allergic to the grass. I wasn't allergic to it until a couple of years ago. And so I know I always have my medication that's going to keep me from itching with me. What is a pill form? Most of them can be over the counter or you can get it from your doctor. Of course, you want to make sure you check with that too, because there could be drug to drug interaction if you're taking other medications. All right. And also, you want to check first. All right. So because it does kind of make you sleepy too. So do you want, and some of the medication, the anti-itching medication can make you sleepy and you don't want that. And sometimes they make you so sleepy that sometimes it kind of drops your blood pressure too. So you want to check with your doctor first. Okay. So check with that and ask how do I, how often am I supposed to apply it? When am I supposed to apply it? When am I supposed to be looking for something really, if I see like a really bad rash and it's itching me so bad, am I just applying the cream or am I rushing to the emergency room? Because it could be something really, really dangerous. Okay. What am I supposed to be looking for? Take medications that I'm supposed to take for diarrhea while I'm there, because you could go there, you say, oh, I'm going back to my country. This is something I'm eating from, even though you cook that same food here, if you go back over there, that same food over there, because your stomach is not used to the water, your stomach is not used to all this, even though it's the same ingredients, but it hasn't been grown the same way. So you can, one person in the same group, you can have 3 or 4 people in the same group and they have no reaction to it, and you're the one sitting there and having like diarrhea, like when you're moving your bowels like continuously. And the more and more that because when you're moving your bowel continuously, the diarrhea can lead to severe dehydration, okay, where your body's like completely deprived of enough fluid to be able to function, and that can lead to a heart attack. It's something even more, more dangerous than that. Okay. So it's important that, okay, I'm going to need my anti-diarrhea medication. I'm going to need medication that just in case if something bites me and my body becomes really inflamed, I'm going to need that. Do I need steroids? Do I need this? My medication for my headache, my medication for my nausea. Also, because again, you go there and eat something and it's like, okay, I think Anthony Bourdain, peace be to his ashes. He was that guy who traveled over. I remember one year he went back to Liberia and he was eating something and he came down with this really bad diarrhea. I mean, he's like, I think he almost, died at that time too. So, and that is not just, okay, yes, because his body not used to it. Even if you've been here, you haven't, again, going back to the fact that you haven't been there for a while. So your body may not react to it the right way. Maybe you might take a couple of days for it to settle, but you want to have certain medications with you that's going to protect you while you're there. Because you can go to the pharmacy there, but it would be best if you already have it. And sometimes you can't trust the medication in certain places. Not every pharmacy, then, the regulation is different in different countries. So it's important to know that. Again, even if you go in like to the islands or anywhere else, you want to have those things with you, especially if you're going for a long time and you're not close enough to your doctors and all. Have those things ready so if you need it. Okay, again, even though it's over the counter, check with your doctor first to make sure you're not having any other problems, and you shouldn't be taking this if you're taking certain medications and all that. Okay, so have that conversation with your doctor. And like I said, nobody can tell you, don't, oh no, I wouldn't go there at this point, but I wouldn't go there. We can only tell you what the medical recommendations are. We can tell you the risks and benefits, and then you have to make that decision yourself. Everybody wants to go see their relatives. Everybody want to go see their friends and want to go see their homeland, or want to go visit, have fun in the Caribbean, or have fun in Mexico, or have fun in Canada. Or nobody will know, if you can afford it, of course. And some people, they may not be going that far, maybe going somewhere in your own state. But it's important that you have those questions, because you could be pregnant too and drive really far away, and that could be devastating too if you have like really, like, again, uncontrolled blood pressure, uncontrolled blood sugar at all. So those things are very, very important. Okay, so this is not conclusive list. So you want to check with your again, check with the travel agency that you're going with. You can also check with the country that you go into for the embassy to check all that. And let me go back here for a second. Check with your doctor. So, and again, just to summarize quickly, check with your doctor, check with the traveling agency, check with the embassy that you go into, make sure you have the right vaccination, make sure you have all your first aid medications and also your first aid kit. You want to have in there like your creams and everything to clean the wound, for bandages, for anything that you may need while you're there. Check again to see with the nearest pharmacy and nurse urgent care or clinic. Maybe there's somebody in the neighborhood that's also health person that does some things outside of the hospital, and also check with that. Okay, so it's important. And if you have young children, if you love your children, you want to keep them safe. So it's important that you also have their records, have your own records, and also with you, check with your insurance company, see if they're going to cover while you're there. Check with your life insurance. Check with your life insurance. We all believe in, what do you believe in? God, higher power, and all that too. And we pray that everything goes well while you're there. But there's always the chance that it may not go well while you're there. Okay, so make sure the person who's your beneficiary, or if you're traveling with all your beneficiaries, have another person that you trust that's here. So if anything should happen, they can call the insurance company and say, this is what's happening, and they can follow through what can go through. We hope that nothing happens while you're there, whether you're traveling next door, in the next state, the next bordering country, or overseas, or where else. We pray that everything goes well. You have fun with your family and your friends, and have a good time, and have take some pretty pictures and make some really good memories. But at the same time, be mindful of everything that may happen, and control what you can control. That's all we can say. Control what you can control, and go on from there. Alrighty. So I thank you all for watching today. For those of you who are watching now, I say thank you. Please give me a thumbs up. If you're watching, please give me a thumbs up. And I'm also trying to raise money to, again, because I'm bringing evidence-based information to you guys. I'm not just somebody on Facebook talking or YouTube talking. Okay, so I would like to be able to pay more for the software. But if you can't, the most important thing you can do for me is to share this show with your family and friends. It may not be relevant to you. This topic may not be relevant to you, but I'm sure it's relevant to somebody else that you love, somebody who might just see it. That's how I usually see things on Facebook, and I see somebody shared it, and I say, oh, I can use that. Okay, so again, Thank you all for watching. Those of you who are watching now, I say thank you. Those of you who will be watching later, I say thank you as well. Stay healthy, stay safe, and I'm on Tuesday, every Tuesday at 7 p.m. Eastern. And also I make daily videos during the week, okay? So keep an eye out for that. You stay healthy, stay safe. Thank you all for your continued support, and have fun. Good night.